Hey, this video is one of the videos I'm making where you're going to see about therapy. Now, therapy is the chapter for the week. Therapy, we usually think of as psychotherapy. Now, when I was in graduate school, many of my older relatives were accustomed to what people usually think. So they were asking me questions such as, geez, John, do you have people lie down on the couch, tell you their problems and go, what do you think? Things like that. No, I didn't, but that was more traditional many years ago in psychoanalysis, for example. And of course, another part of the stereotype was a gag gift that a psychiatrist I knew was given way back then, 40 plus years ago, where it was a doll of a psychiatrist. You pulled the string and it said a bunch of different things with a German accent, such as, that will be $100, or tell me more about your mother. But again, that's psychotherapy and some stereotypes. But there are other types of treatment that are totally different. So one type is biological treatments. Now, biological treatment is based on the medical model, the older view that biological factors are the key things to focus on. And it's still, in some ways, a significant piece of what we might do today to treat somebody. But some of the strategies aren't used. For example, surgery is one of the techniques that was used in the past. Most people don't get surgery, of course, these days to cure mental health problems or to improve them. On the other hand, electroshock therapy, sometimes abbreviated ECT, electroconvulsive therapy, or EST, electroshock treatment or therapy. Again, that's pretty rare, sometimes used for severe chronic depression, not very common again. What's much more common in terms of the biological model of treatment is medication. Medication is based on the idea that what's going on inside our bodies has something to do with our behavior and our moods and our internal mental states, and we can improve that by changing the chemical action in our nervous system. So what we're going to do today, it's a little play-along quiz. I'm going to give you some of the questions and then answers. You're going to decide just right now with these medications. So you may have no knowledge of that. Your grade is not based at all on how well you do scoring, but play along just for fun. There will be some questions to ask. I'm going to put on some glasses so I can see a little bit better. Okay, so your question now is anxiety or depression. Are these medications primarily for anxiety or depression? Many of them can be used for a couple of different kinds of problems. So Celexa, C-E-L-E-X-A, anxiety or depression? Depression. It's an antidepressant. Again, maybe used sometimes for anxiety, but we consider that more for depression. Ativan. Now, some of these are not generic names, they're brand names. I don't have them all memorized. Some of them I do, but Ativan, that's for anxiety. So again, guess and guess fast as we're doing this. Wellbutrin, depression. Again, the question is depression or anxiety. Amitriptyline, depression. Effexor, that is depression as well. How about Cymbalta? That's depression. I know I've seen TV commercials for Cymbalta, so must be good, I guess. Okay, Zoloft, anxiety or depression? It's another antidepressant. Remeron, depression. Lexapro, that's also depression. And last one, Trazodone. That's depression, although it's usually prescribed at bedtime and for sleep. That's often for sleep. Okay, now let's go to a different category. Let's do mania or psychosis. So since we've just finished that chapter on bipolar disorder and manic symptoms and psychotic symptoms and disorders such as schizophrenia, you should have a little bit of warm up to that. So is it for mania primarily, or psychosis such as schizophrenia and other disorders like that, which are different than bipolar, which has manic episodes, or at least one? Latuda, that's mania. So again, question, psychosis or mania? Zyprexa, that is for psychosis. Zyprexa, okay. And let's go to Risperdal. Sometimes this is, I think the generic name is risperidone. Psychosis, okay. Psychosis or mania? Thorazine. That's psychosis as well, Thorazine. That's an older medication that was used many, many years ago, still may be used. Again, some of these medications, I'll digress for a second. The antipsychotic medications tend to calm people down. They reduce the severity, frequency of hallucinations and delusions, some of those really severe problems that psychotic disorders and schizophrenia have. The manic bipolar medications tend to even out the moods, so they're not quite as severe highs and lows. The antidepressants do various things, and the anti-anxiety medications tend to calm people down and relax them. If you're diagnosed wrong or you take too much of them, they really slow you down, put you to sleep, knock you out for a long time period. Working with a prescriber to get the right amount is very important with all of these. And knowing the side effects and drug interactions, of course. Nothing that I handle. I'm a psychologist, not a psychiatrist. Psychiatrists are prescribers. Okay, so again, mania or psychosis. Seroquel, antipsychotic. Lamotrigine, that is mania, a mood stabilizer is what we might call it. Abilify, psychosis, antipsychotic. Lithium's been around for a long, long time. That is for manic behavior, manic episodes. A newer one, Vraylar, Vraylar, antipsychotic, and Geodon, antipsychotic. I left out one from before. Anxiety or depression, we're going backwards a second, Paxil, that's depression. And again, some of these are used for anxiety disorders like OCD, and other kinds of anxiety, but they're classified as antidepressants and often used for that more often. Okay, now there's another category here, and medications that are used for other things. So for example, we have Concerta, Vyvanse, Strattera. All three of those are used for attention deficit hyperactivity disorder, ADHD. Now, here's a little bonus kind of question at the end. Which of these three medications is the most frequently prescribed in general out of all the different medications that I have or haven't mentioned? According to my research, your choices are Prozac, Xanax, or Cymbalta. Prozac, Xanax, Cymbalta. Which is the answer? It's B. It's Xanax. Xanax is considered the most frequently prescribed medication. And this is a tricky one. A lot of the physicians I know are careful about this. They're cautious because of the problems of possible physical and psychological addiction. And of course, you take too much Xanax, it's going to interfere with your functioning. If you're going on a plane and you have a severe flying phobia, well, a little bit of Xanax might be prescribed. If it is prescribed, might work well for you, but certainly not if you're flying the plane. And of course, we don't want anybody flying an airplane that's a commercial or other private plane to have any type of anxiety disorder, certainly while they're flying. That wouldn't be good, I don't think. Anyways, there's some questions for you to answer about this. See you next time.